There are various ways how we label our work-related trauma. It can be vicarious trauma, compassion fatigue, secondary traumatic stress and direct trauma, empathetic strain, and emotional burnout. And you probably are all aware that in the ICD-11, which is WHO's International Classification of Diseases 11th edition, which will be out very soon, burnout has been recognized as a syndrome, and it is conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by 3 dimensions: feeling of energy depletion or exhaustion, increased mental distance from one's job or feeling of negativism or cynicism related to one's job, and reduced professional efficacy. So when we talk about vicarious trauma, many of us have been, who are in the field, have come to the field because of prior traumatic experiences. You are all aware of the concept of the wounded healer. So we all come with our background. We serve and work with people who are severely traumatized. So this creates a field where there is a high risk of professionals being traumatized.
Burnout and secondary trauma are elicited from different exposures to stress, and the symptoms are better addressed with different self-care and different staff support techniques. So being able to see what's most impacting someone is really helpful in being able to provide support or guide them in their self-care practice. So burnout is that work-related hopelessness, the feelings of inefficacy, of exhaustion, and you would address those symptoms with coping skills that help energize or engage a kind of frame shift from the workspace to a social space or to a decompression space at home. You would use either clinical or administrative supervision, help to shift tasks, workload, time off work, and that primary protection is really a reasonable workload, as we were all talking about, and recognition for the achievement, as well as regular breaks. Comparatively, secondary trauma or vicarious trauma is where the work-related exposure to trauma or traumatically stressful events results in the experiencing of traumatic symptoms in the staff, even though they may not have experienced their own trauma episode, or they may have and it may be triggering. And this is an expected response to being present with unspeakable human suffering. It's kind of a occupational hazard of our work, and I think it's really important to present it that way because it can be perceived as a vulnerability or a weakness, but none of us is really born ready to do trauma work. We all need ongoing training and support to build and maintain those muscles to keep ourselves healthy in this work and keep our baseline functioning high and our own resilience high. So coping skills for vicarious trauma or secondary trauma are more targeted to self-regulation and symptom management. And when you look at it from a management perspective, thinking about breaks from work that include the exposure and creating that space for self-regulation. And also that developing of a sense of empowerment and meaning in life and work, kind of connected with how we would treat trauma and that connection to a sense of meaning that comes through post-traumatic growth.
As you can see here, we start by have physical pain, then we are feeling totally exhausted, then our performance is dipping down and down, then we stop putting effort in our work, and the final one, the last one, is we don't feel excited for work anymore. And if you work without passion, it's for me like a punishment. What are the warning signs of burnout? This sign can be physical, such as pain, weight gain, and feeling tired. Headache, always we say, I have headache, I don't know why. I have somatic, I don't know why. I have pain, back pain, leg pain, etc. Emotional, such as anxiety, depression, self-blame, self-criticism. Negative self-talk. Cognitive, such as inability to concentrate, inability to think straight, dissociation, or behavioral, such as anger outbursts, avoidance, numbness, drugs, and alcohol use.
And vicarious traumatization can have effects on a spiritual, as in loss of purpose, loss of meaning, questioning the good and the bad in this world, and relational dimension, which is maybe decreased interest towards the loved one, self-isolation, etc. And the higher the work-related burnout, the more evident the symptoms become. And this also affects our professional performance. Our performance level is decreased. Morale in staff may go down, or our morale while doing our work. We might be detached, withdrawn from co-workers, worsened communication, conflict at work, and also behavioral ways that we manifest, being late to work, being slower at doing your duties at work, exhaustion, irresponsibility, poor follow-up. So these are the things that are side effects of burnout and vicarious trauma. %, experience traumatic stress symptoms in the severe range. People who do not themselves experience trauma but attempt to traumatize people. 50% experience high to very high levels of compassion fatigue. 34% met PTSD diagnostic criteria from secondary exposure to trauma, and 37% experienced clinical levels of emotional distress. Christian Prost, our dear colleague, many years ago, not so many years, but some years ago, did a study among torture treatment centers, and there about 31% of individuals had their own, of people he interviewed had their own trauma histories and very severely affected by the histories the material they were working with. And there are various risk factors, personal and professional, that may contribute to the development of formation of vicarious trauma and burnout. Among them, pre-existing trauma history, young age is a big risk factor, young age without proper supervision at work, mismatch between organization and the individual who works in the office, the lack of professional support system, inadequate orientation and training for the role.
So we did a survey amongst our staff. In 2020, we had a 36% participation rate. Around 6,000 plus colleagues replied, which is, at the time, it was the biggest humanitarian sample. And on the one hand, we saw, yes, humanitarians and the ICRC, specifically the exposure to potentially traumatic events is high, not only because of the work, but also because of the lives. For those of you that are from the communities where you work or that are living next to those communities, you were mentioning Gaza, so no more to say, but so many places around the world, unfortunately, Sudan, Ukraine, etc. There's this combination between of the extra exposure you get because of your work plus what you already live because you're in that context. Sexual violence is a problem in all organizations, and it doesn't exclude humanitarians. So we also could see that 12% of our staff had been exposed to either sexual harassment, understanding that continuum, or it was 5% who had suffered sexual violence inside or outside of work in the last year. But again, if you have suffered rape or sexual harassment and then you show up to do the type of work you do, this is something that I think we sometimes are not aware of. And then what we saw is that around 30% of our staff have screened positive for at least one mental health condition. This data is very similar to that of other studies done with humanitarians, and there was 10% of the colleagues that actually screened positive for at least 3 or more. So we say screen positive because we use scales. They're not clinical interviews, but it's an indication that those colleagues should be having at least a clinical interview to assess. We used a tool that is called the COPSOC3, and it looks at the psychosocial risk factors in the workplace, what is a protector and what is helping or protecting mental health at work and what is not. So the things that we need to decrease: high work demands, working overtime. And I'll show you now another slide because I think it's interesting to see that actually the workplace aspects are as important as the exposure. when you look at this is the result of odds ratio of those that rated high work-life conflict. They were 2.7 more at risk of secondary traumatic stress, or 1.9 more at risk of PTSD. And I think this is an important point to take home. That the way, it's not only the exposure, is does the organization have your back? And do you have a condition in the workplace that you can recover from what you're doing? So you can see there, of course, high insecurity, low possibilities. You can also bullying, sexual harassment, and how that is related to anxiety, burnout, depression. The other reason why we really have to look at the workplace factors is because we can manage them. We cannot control what is happening in the conflict or in the war around us, or the stories that the clients that we support bring. This is part of the exposure that is very difficult to mitigate, but you can, as an organization, as a manager, as a team, you can improve the workplace conditions. So there's an element of control.
And I think what is an important discussion point for us as a collective is how we move towards becoming vicarious trauma-informed organizations, because we all are trauma-informed organizations, but acknowledging that vicarious trauma is a part of our working experience, and the experience of others' trauma is an occupational challenge for our field, and that working with victims of violence has shown to change our worldview, and it puts us as individuals and also our organizations at risk for a range of negative consequences. So a vicarious trauma-informed organization recognizes these challenges and assumes the responsibility for proactively addressing the impact of vicarious trauma through policies, procedures, practices, and programs. So it's a responsibility of an organization to allow and create space for staff to feel safe, feel heard, feel empowered in the work that they do. Because when organizations don't address vicarious trauma, we have low productivity, which I talked about, low level of cohesion, communication, poor organizational health, and we have high staff turnover. And key aspects of a healthy vicarious trauma-informed organization, and this is also based on a body of research, is leadership and mission, effective leadership, clarity and alignment with mission. Also communication style, horizontal or vertical within the organization. Management and supervision, clear, respectful, quality and inclusive of vicarious trauma. And we're going to have much more on supervision afterwards. Employee empowerment and work environment to promote peer support, team effectiveness, ongoing professional development so that people permanently feel that they're being cared for and their professional development is a part of their everyday work. And staff health and wellness is also a key aspect to a healthy organization. Failure to maintain boundaries, over-identification with clients, lack of professional distance, lack of therapeutic strategic concept, diffusion of roles and competencies, ambulance chasing, like hectic, uncoordinated interventions. These cause stress and conflict level. Whereas on the other hand, research shows that good leadership, delegation, clear definition of roles, so on and so forth, maintenance of boundaries, care for caregivers program, coaching for leaders, which is essential because leaders also need to be assisted and accompanied in their leadership roles. This supports organizations with low stress and conflict level. We are very often very intimately relating to the dark side of humanity, and sometimes we need reminded that we are the warriors of for justice, and we need support. We cannot do this alone. There's an African proverb: if you want to go fast, go alone. If you want to go far, go together. So that's why we need each other. We need professional support in order to go far and together, because our struggle is far from over.
I would like to share some therapeutic techniques which work most of our staff, and I use to prevent staff stress and burnout. We usually used relaxation techniques such as breathing relaxation, mindfulness, meditation, which they can practice in any situation to relax them. The feedback we received so far is that it enhances their quality of life, relax immediately, helps to deal with their anger, etc. Actually, we discussed self-care practice. They practice some distraction techniques when they feel so stressed, when their productivity level, if level is down, they use some distraction practice like hearing music, talking with others like colleagues, working for 5 minutes, having fun with others, which helps them to reduce their stress. And by practicing these distraction techniques, they find a space for themselves. It increases their individual productivity and performance. Uh, uh, they also practice some thought challenge. It helps them to restructure their dysfunctional thought pattern and practice functional one, which reduce stress and burnout and improve relationship with colleagues, family, and other persons. We also some practice progressive muscular relaxation technique, doing sleep hygienic sessions to improve their sleep, giving psychoeducation, goal settings, assertiveness practice, practice pleasure and mastery activity, and time management. All those therapeutic techniques helps our staff to reduce their stress and makes them more energetic and make their productivity level well.
So, as most of you know, emotional stress reaction are normal reaction to abnormal situation. There is a daily checklist we can use with ourselves. For example, this daily, how am I feeling today? To be honest, I feel a little bit stressed about my presentation. What I am grateful for today? Gratefulness help us recognize all the things we have to be thankful for. I am grateful for being with you. I am thankful for your attention. Think about all good things you have in life. Many research studies have shown that gratitude is associated with greater happiness. So, cultivate gratitude. What do I need to do today? Think about this. Everybody think alone. And I tell myself what I do. I feel that I like to be surrounded by happy and vibrant friends. What do I want to accomplish today? I would like to accomplish this presentation, to feel free, okay? Then after the last one, what's something I can do today that would be good for myself? Leisure. Leisure activities can be a wonderful way to relieve stress. Yet many people feel like their lives are too busy for hobbies, games, or extra fun. But building time for leisure into your schedule could be key to helping you feel your best. And when you feel better, you'll perform better, which means, as you see here, leisure time may make your work time more efficient. As I mentioned before, self-care is not selfish, but self-care is giving the world the best of you instead of what's left on you. Now, develop your self-care plan. An effective self-care plan should be tailored to your life and your needs. It needs to be something created by you and for you. It's not one-size-fits-all strategy. Your self-care plan will need to be customized to your needs. So keep calm and make a self-care plan.
So in our experience, it was we saw that clinical supervision, that it can be a very effective support, as it is a safe space for reflection and finding solutions for professional challenges when working with traumatized clients or clients with complex psychosocial needs. And for us, it was very good that we had somebody external coming as supervisor, an experienced person in the field, but also a specially trained person who has no double role in the organization. There is no control. It's just a place to reflect together. And so, this supervisor can take an outsider perspective. This can be individual supervision, and it can be in a group, and it can be in a team. And we thought it's really good if it's in a team, working together, and if it's at a regular, timely scale and along the work life of the professionals. And we at the Berlin Center, we were lucky to experience a certain method, which was developed by Johan Lansen and Ton Hans from Holland. And it is a trauma and culture sensitive method. And the sessions are structured in several rounds, and the supervisors explore and reflect cases on different layers and from different perspectives in order to find solutions for their challenging or burdening professional situations. Important, it's not top-down method. Yeah, it is not like a technical supervision or a teaching supervision, but it's a guided reflection and mutual consultation in the team and with the supervisor on an eye-to-eye level. And the supervisor facilitates in a supportive and very participatory way, and works with the problem-solving potentials of the team members. So what we found that this type of supervision, it helps a lot to prevent burnout and secondary traumatization and compassion fatigue, to see the risks, because we sometimes are over-identified with our clients. So this helped a lot, and we think that external supervision, if possible, should be part of a policy for staff care